Hi all, thanks so much for joining Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we are welcomed by Dr. Will Davies, who is the founder and director of the CHILL Project by Allegheny Health Network. Thank you so much for being here.
My pleasure to be here.
And we had this interview scheduled and the timing just could not have ended up to be more applicable. I don't want to say perfect because it's certainly not. But the project that you work on, the CHILL Project, is focused on mental health in schools of students K through 12 through a 3-tiered program. And whenever events like this, the tragedy that happened this week in Texas, what do you think as somebody who's dealing in this field? Does this, do you look at this and think we must focus on mental health? Just what are your thoughts and how to move forward from here? What are students saying? What are teachers saying?
Yeah, we've definitely seen a pretty strong reaction in the schools that we serve. There's been modified lockdowns, a lot of communication between administrators and faculty and how to speak to the students and providing support groups. We've seen definitely an uptick in the conversations within our spaces with students around this topic. And something that I think can be very useful from our program standpoint, we have a space in every school that we serve called a CHILL room, which is a designated space for kids to come and discuss what's happening in their lives, their concerns, what they're stressed about, share their emotional distress, learn some skills and apply those evidence-based coping skills so they can get back to class and be academically successful, because it all ties together, emotional well-being and the academic side of things. And when you have that space, it helps a very limited and stretched out from a bandwidth perspective, school, faculty, administration, counselors, who are really just firefighting a lot all day long. And that's what we see. The acuity has just gone through the roof. And a lot of the schools we serve have become very reactive to mental health concerns because they just don't have the bandwidth because of the structure of the way of the school. Things haven't been updated in 30 or 40 years in a lot of cases, and it doesn't really serve the school community well. And so what our spaces do, and we have multiple tiers within that space, but we allow students to have that space that they can start to form a community where they feel like they can be heard. They can start to develop trust with one another. We involve teachers in these spaces where they start to, can communicate with students better. And when you start to have that sense of community and that sense of trust, you have a place where this communication can happen. And folks start to feel a little bit more heard in these spaces. Now, I can't say specifically if this would have prevented anything, but they certainly can have a space where they can be heard and concerns can be addressed very much so in advance. And we've seen that time and time again, particularly recently, where we have very, very dangerous, deadly concerns that are coming into our spaces. And we can get those addressed before someone harms themselves or harms someone else.
How does that space, when you said dangerous, deadly concerns coming into the space, it's, you can almost, right now, you can almost see it happening. So can you tell us a little bit more about how that generally manifests for you? How does someone who's overseeing this program detect that? And then how do you diffuse that?
Absolutely. So, we see a wide range of concerns in these spaces. So anywhere from a little bit of test anxiety on one side of it, peer conflict, but very seriously on the other side, we get some pretty serious concerns where students are, coming in and expressing that they want to harm themselves to the point of wanting to kill themselves and possibly harming other folks and killing other people. So, we can, through these trusting relationships that we build with the students and with the faculty in the school, this becomes a space that can really start to scratch the surface to get folks the care that they need in advance before something really tragic happens.
Mm-hmm.
So when you get those people coming in saying that they want to harm themselves or harm others, what do you do? What are the action steps that you're taking to help these people?
So at that point, we have very strong communication with the schools and the administrators and the counseling departments in the schools. And we tend to lean on the crisis plan of the school at that time. So we make sure that the school is directly involved. We contact the parents. We make sure that we follow through on our end with getting this student to the hospital if needed, whether it's to an emergency room because they've harmed themselves, or to a psychiatric facility in prevention of harming themselves later on or harming others. So we make sure we follow through in that. And sometimes we will actually go to the hospital and make sure that that happens, and we can help facilitate that and also their transition later on out of that service.
Going to the school shooting that happened earlier this year, I think it was Michigan, that person also displayed disturbing behaviors before even the day of the event. The parents were called in, and if I'm remembering correctly, the administrator suggested that they take the child home, and the parents didn't. So what do you do if you're encountering, you're trying to do everything you can to help make this right? What would you do? Is there a way to step in if this is a dangerous situation and the parents are refusing?
Yeah, and we have run across that before, and that's an unfortunate reality that sometimes happens. And so there's certain processes that we can rely on, like what's called like a 302 or a involuntary process, where we can work with the school. The school kind of handles that communication, and we can get the student to the hospital like via police or ambulance at that time. But in the entire process, we have to understand that the parents are very distressed, and that they're also not, the line of thinking and judgment might not be as clear as it could be, because obviously their kid is, trying to harm themselves or harm others. And so we try to take that into consideration as well, and really make sure we respect the parent in that decision-making process. But ultimately, if we feel that this student is going to be a risk to themselves or others, that we have to then, take a formalized legal action such as that.
I find it really interesting, Will. You've mentioned several times the importance of the relationship that you're developing with the teachers and then with the students. And I find it interesting that someone who's at that level of really wanting to commit that intent of harm to themselves or to others is yet still reaching out for help. It's a kind of almost like a plea that they're reaching out to you. And so it gives you a little window in which you can intervene. Do you generally find that most students are just looking for that help? And if they just had that trusted person they could reach out to, then potentially we could diffuse, a lot of this?
I think you hit that nail right on the head. I think a lot of students are just looking for that person, and the way things are structured, sometimes that person doesn't exist in a school, and kids have become so socially isolated recently in particular, that it has become a concern where the kids aren't even talking with one another, let alone the adults in the school sometimes. And so any connection that we can make for these students, any trusting adult relationship, like the adults in the building have to come around the students and provide that kind of a loving and nurturing, compassionate environment for them to be able to open up so we can get them help.
Is that a challenge in itself? Because a lot of times, and again, maybe I'm off base on this, but it seems like a lot of times these people are isolated. Maybe they're a little bit more alone than other people. They're displaying things that might not be popular behavior, scary behaviors or interests. So are people resistant to trying to get close to them because it's scary?
Sometimes that happens, but what happens is often you pick up on some of the warning signs, and we work very closely with school counselors and administrators. Kids have the ones that are cutting class, their grades have dropped dramatically, they're having truancy issues, and the counselors do a great job connecting us with those students, or we connect the students with the counselors, and we work together to identify who those students are. And the schools they have a pretty good idea of who those students are, and then they can use us to help lean into those situations. And through, it takes time sometimes, but we, often create very caring and nurturing relationships with those students, and then they open up.
Are you a next level from the counselors? Because it sounds like the school still has counselors within their school, and then they lean on you for additional support.
That's correct. So we work directly with the counselors. Like, one of the things I always say, like, we're not there to take anybody's job. We're there just to help be support for the students and also for the teachers as well. And that's something that the counselors often don't have time to do at all, to be there for their peers. And sometimes their peers really need the assistance, and they're in the off hours, they tend to be lining up with the counselors as well.
A few interesting points that you're making, which are kind of all running around in my head right now. So I'm going to see if maybe they come out in some sort of a coherent fashion. I'm honestly very fascinated by the thoughts you have around trust. You're mentioning the trust that you need to build with the students, with the teachers, and on the one hand, so I'm thinking the schools are somehow not able to do this on their own. So what's sort of missing? What's preventing them from doing it? Then that makes me think, well, then how come you folks are able to do it? And so what's that mechanism and methodology? And then I'm thinking, well, then are we always sort of, going to be in a position where we got to bring in outside help to do this? So I hope those kind of points kind of make sense, and maybe we'll, at least whichever ones do, maybe you can help us tease out how this whole trust thing works or doesn't work.
Yeah, those are great points. And I do believe that I understood what you said there. So there's a lot of structural issues that have been around in schools for a long time. And that comes down sometimes to priorities of a school board, of a superintendent. Some folks understand the connection of emotional well-being and academic well-being. Like, they are totally aligned. Some folks don't see the connection at all. And so sometimes, depending on where we go, we run into that. And so we try to illuminate them with the data behind this, that these things are connected. I've been in school board meetings where, I'm asking for a few $1,000s for additional services, and, they're giving me a hard time, but they have just signed off on $5 million for new football turf. So there's a priority sometimes in different school districts. Like, sports are important, but, if you want the kids to be able to play the sports, you also have to take care of them at the same time. So I think it's evolving. And I think the pandemic, one of the silver linings is that the stigma around mental health is starting to come down a bit. People are talking about it more, and the priorities are starting to shift. And we're noticing that across the board, and there's a lot more openness to talk about these kind of things than, being behind in the shadows as we used to be.
It's very, very intense and really difficult. And so, Stephanie, with my final question, I'm wondering, you and I were talking about this earlier, with your school system in terms of services that they're thinking of providing or not providing. And it's maybe a smaller piece of the whole equation, but I just wonder if you would be open to kind of sharing that.
I cannot overstate the importance of people having access to mental health care and caring for students in that way, because mental health is health. It's just as the way that you go to a gym to maintain your blood pressure or your cholesterol. Mental health is health. And to not support that or not fund that is an absurd decision.
Thanks for answering that. I guess I'll turn to you. Do you have a final question for Will?
What drove you to start this program? What were you seeing? What happened in your own experience or piqued your interest in this field that led you to develop the CHILL program?
The seed for this program came out of some lived experiences that I had prior to developing this, where I was in two different, helping serve two different school communities. One was a school with very high community violence and trauma, very kind of a low SES community, where that year 5 students had died from community violence. And walking into the schools after the fifth one, it was like walking into a funeral. And you can only imagine, like, these administrators and teachers, this is like losing 5 babies of theirs, right? And the impact, and I saw the impact on teachers, and something that I think is also important to stress here is the health and wellness of the teachers and how that directly connects with these students. And if we're not addressing that, which is something that we also do, then we're selling the kids short with their success, because we need these teachers to stick around. The burnout is through the roof, the turnover is through the roof. We're going to have a shortage. People are retiring early, and so we need to take care of them as well. And so that's an important point of this, and it also helps with the buy-in process as well, to talk about their lived experience. And then, so I was in that one school, and then the same year I was in a different school that was kind of on the other side of the spectrum, very high socioeconomic status, didn't really have community violence, but 4 or 5 kids lost their lives to suicide that year. And so it dawned on me, like, 2 different schools that across the spectrum here, the pathways are different, but the end result is the same, which is students are dying. We have this kind of culture of death that's happening in our schools. And as healthcare providers, what are we doing to work directly with school districts to disrupt the pathway that leads to death of the students? And that's the underlying passion for this, is to bring life to these communities, to make sure these kids are graduating and becoming very productive citizens of the world, and staying alive, and redirecting these pathways of death. And so that really, it's rather morbid, but that is the underlying passion for what we're doing here. And that's really what seeded this, and then dug into the literature around it, what the best practices are, what other programs in the country look like, and develop the structure based off of that.
What's the success been like since the implementation of these programs?
So we started in 2019 with 2 schools as a pilot, just to see if it would work. And we're in over 20 now. And what we have seen is very high utilization of services. We've increased access for students in these schools dramatically. Some schools over 400 or 500% increase. They really need these services. We have seen teachers utilizing the skills that we use. We've seen a statistically significant drop in the perceived level of stress that students exhibit from before and after our interventions, going back into the classrooms. And what's really important to note is we have seen a drop in students being placed outside of the school in different levels of care, but also more importantly, what I know districts like to see is students not being placed out into approved private schools like they used to be. It's an incredible cost to the district, and it is something that, we want these kids in school, being with their peers, and not in an outside setting. And so we're able to help through our interventions keep these students in school as well.
You're trying to disrupt the pathways that lead to death. And
Yeah.
so is there any evidence in these 20 schools that that's starting to happen?
I think so. Right now we have the anecdotal evidence where we know that there are students who are coming into our spaces that are planning to kill themselves or harm other people. And we know that we have diverted that pathway for those students. So for me, that's very successful. And this is more than just a handful. There's a lot of these cases. And connecting with their families, getting them situated with appropriate services. If they need medication, we can do that for them too. And so that to me is like the feedback that we're actually disrupting that kind of outcome. It's not a full, safe way of doing it. We've had kids who we've lost in some of our schools, but I think there would have been a lot more if we weren't there.
Thank you so much for sharing this conversation. Again, the timing couldn't have been more applicable to have you on here talking about this. And I appreciate the work that you're doing to help serve these students.
Appreciate the opportunity to chat with you both and share our story.
Thank you, Will. It's very inspiring. Really appreciate your work.
Thank you.
And thank you all for watching. I'll talk to you soon. Bye-bye.